Hi, I'm your pharmacist today. Here are 2 questions for you before we start our topic today. Do you know that both prescribed and over-the-counter medications need to be disposed of when they are expired, unused or damaged? If yes, do you know how to properly dispose of them? For your information, the usage of medication in Malaysia is rising while a massive amount of medication is being thrown away every year. However, how many of them are actually disposed of correctly? Many past study results show that the public lacks awareness of the safe disposal guidelines. In Malaysia, the most common method to discard the unused medications is by throwing them as household garbage, which may not be always appropriate. Why is the proper disposal of medication so important? Firstly, the drugs from improper disposal can leach into the water system and contaminate the waterways and even our drinking water supply. These pharmaceutical-related chemicals potentially harm humans and threaten the marine ecosystem. Secondly, if the drugs are not discarded suitably, they might be obtained unintentionally by children or animals and lead to inadvertent poisoning. Thirdly, improper drug disposal can also increase drug abuse activity as the would-be abusers have easy access to those medications. After knowing the importance of proper disposal, you must be wondering how to practice it. So, let's find out in the next part of the video. In most cases, the best option for disposing the medications is through an official drug take-back program. In 2010, the Return Your Medicine program was introduced by the Pharmaceutical Services Division, Ministry of Health Malaysia, MOH, where patients can return their unused or excess medicine to health facilities under the MO for safe disposal. Now, let's see how it's done. First, collect all your excess, unused or expired medicine. For prescribed medicine, your personal information should be removed or scratched from the labels and medicine packaging. Then, bring those medicines to any pharmacy counter or medicine return box dedicated to collection of medicine. After that, those returned medication will be burned under extremely high temperatures by incinerators. One important thing to remember here is all kinds of dosage form can be returned to pharmacies, except for the pressurized medications such as metered dose inhalers and aerosol sprays, as they can explode under high temperature. So, if you have any medicines that are no longer needed at home, do not hesitate to return them to the drug take-back location. Next, if the drug take-back programs are not readily available while the medicines are potentially dangerous and found on the specific list which is instructed to be flushed into the toilet, you should do so to prevent accidental ingestion by children and pets at home. Remember, only the medications under the FDA list can be flushed. If you are unsure of what medications fall into the flushing category, you can always check the prescription label or patient information leaflet to find disposal instructions. The examples of medications that need to be handled through this method are often the drugs that contain opioids. For instance, fentanyl citrate, morphine sulfate, and methadone hydrochloride. However, for the medication that is not on that specific list, please follow its relevant instructions to discard it. Finally, you can dispose of the medication by discarding them into the trash bin. It is safe to throw out most of the drugs in the trash if there are no drug take-back sites near you and the drugs have no specific instructions about disposal, such as flushing into the toilet. You should follow the MPTS method to throw the medication away safely, where the M stands for mix. Mix your medicines with unpalatable substances such as used coffee grounds, cat litter or soil, but please note that you should not crush the tablets or capsules. Next, the P stands for place. Place the mixture in a container such as a sealed plastic bag to ensure they will not leach. Then, the T stands for throw. Throw the container in the garbage. Lastly, the S stands for scratch out. Scratch out all your personal information if the medicine is a prescribed type to make it unreadable before you dispose of it in order to protect your privacy. Please be sure that you never mix needles, lancets, or other sharp instruments into the household trash, but always put the sharp items into their disposal container until about 3/4 full before returning to the pharmacies or local trash removal services. After watching this video, you should start to practice safe disposal for unwanted medication to prevent any possible damage and harm. Think before you trash. Thanks for watching.